At this point in my life, I'm in my mid 60s, and I'm religious about getting a opinion about what my blood work is about. So about 20 some years ago, I was told that I had high cholesterol, and that's the total number. And the immediate response was, you have to go on a medication. I'm not a big medication person.
Hmm.
In fact, I don't take any medications at all, which I'm happy to say that has worked for me. I do take supplements, but no prescribed medications.
Hmm.
And my initial response to them asking me to go on a medication was, no, I'm going to handle it with diet and exercise. I didn't go on it. My cholesterol pretty much stayed the same over the last, that was about 25 years ago. And then every year after there, it pretty much stayed the same. Even went down a little bit just by
Mm,
doing what I was doing.
right.
This last blood work was pretty much the same result. Uh, Practitioner called me after my blood work, said the doctor wants to put you on a low dose of cholesterol medication. I asked Charlie the question, what do you
Right.
think about cholesterol? And that quick response from doctors to say, go on medication.
Welcome to the CoachMD podcast. I'm Dr. Charles Glassman, bringing you 3 decades of experience as a physician and a coach. Join us as we navigate the maze of medical advice with real-life stories, empowering you to take charge of your health. In our That Happens segment, guests share transformative experiences, reminding us that we're all human and not just patients. So get ready for a journey into healthcare reimagined, where empowerment and discovery pave the way. Hey, I'm Dr. Charles, aka Coach MD. In my over 30 years of medical practice, I've made it my goal to help you create a strong mind, a healthy body, and an unshakable spirit. And that's why I've decided to launch this podcast, because I know that so many people have questions when they go to the doctor. They get the doctor speak, they get talked to like a patient. And what I would like to do is bring to you people who have experienced the medical professions and talk about their maybe medical issues. And so we can navigate how I could help them navigate that, as I did with all my patients all these years. And I had a very personalized practice where I would sit down and talk with people. And that's what I want to do in this podcast. So we're just two people talking about with medical conditions, medical questions, and approaching them with a open mind, with common sense, and not just getting the textbook. But also in this podcast, we're going to have a segment called That Happened. And That Happened is just like it sounds. That happened. We can't believe that something in our life happened the way it did. And that's because it's important for our general wellness and well-being and our appreciation of life to understand that we're just not a body. We're a mind and a spirit. And so this That Happened segment will bring it all together. It rounds out the edges of just being a doctor and a patient. So I'm going to introduce you today to my guest, Angela. And Angela is a very dear friend of ours, my wife and mine. And, we have a great friendship. And the reason why I decided to have Angela on the podcast today is because she experienced recently something regarding the topic of what I'm going to talk about today, and that's cholesterol. And she experienced something with that and dealing with that with her doctor. And I kind of want to go through what she went through, and just hearing the story and what the doctor recommended. And I'm going to give you some insight on that, and we're going to have a discussion about it. So,
Mm.
Angela, thanks for joining us today. We're really excited to have you on the Coach MD podcast.
Hey, Charlie, thank you so much for having me on. And it's a great honor to open up your podcast with my my issue
Yeah.
and what I've been dealing with for probably the last 25 years.
Wow.
So thank you for addressing that and to kind of piqued my interest more about how to handle that without doing a prescribed medication.
Mm, great.
So
So,
thank you for that.
tell me, yeah, sure. And Angela's talking about, as a doctor and a friend, she knows that she could run things by me, and she ran this by me a couple months ago, and I had some suggestions, and we're going to talk about that in a second. But before we get to that, tell me a little bit about when you said about 20 years ago. Kind of what was that about? Like what were you told? How was that brought up?
Yeah, so, we get our yearly blood work and our yearly exams. And, at this point in my life, I'm in my mid 60s, and I'm religious about getting a opinion about what my blood work is about. So about 20 some years ago, I was told that I had high cholesterol, and that's the total number. And the immediate response was, you have to go on a medication. Low dose, no explanation about the ratios and what LDL, HDL, no education about that. So I kind of started digging into that. My initial response to that, because I'm not a big medication person.
Hmm.
In fact, I don't take any medications at all, which I'm happy to say that has worked for me. I do take supplements, but no prescribed medications.
Hmm.
And my initial response to them asking me to go on a medication was, no, I'm going to handle it with diet and exercise.
Hmm.
So
Yeah.
I'm fairly athletic. I eat well, but there's always room for improvement. And then I didn't go on it. My cholesterol pretty much stayed the same over the last, that was about 25 years ago. And then every year after there, it pretty much stayed the same. Even went down a little bit just by
Mm,
doing what I was doing.
right.
This last blood work was pretty much the same result. Uh, Practitioner called me after my blood work, said the doctor wants to put you on a low dose of cholesterol medication. And I said, no, I'm going to wait. I don't think it's necessary. After digging a little deeper and knowing that it's partly inflammation, partly a diet issue, partly just because it's genetic,
Hmm.
um, I asked Charlie the question, what do you
Right.
think about cholesterol? And that quick response from doctors to say, go on medication.
Right. So,
And
go ahead. I'm sorry.
yeah, and after asking questions, I had a friend who worked for a pharmaceutical company, and he basically said they needed to take a statin just because, just even if you didn't have high
Right.
cholesterol. And I thought, why would you do that? Why would you take a medication if you don't even need it? So after asking you about the cholesterol and getting more educated, I felt like, wow, I never even heard of the calcium
Right.
score.
Yeah. So we're going to
So
get into that in a second. But I would like to, talk a little bit about why the doctor is, wants to do that, and why is that such a reflex? And there's a lot of pressure that goes
mm,
upon the medical doctor to make that recommendation. And so, what is cholesterol? First of all, I just want to explain to everybody, the audience, that cholesterol is a very complicated molecule. Okay, it's kind of like a circular shape, and but the most important thing about cholesterol is that it actually is the prime component, it's the backbone of every cell in our body. The cell wall, the cell membrane of every cell in our body is composed of cholesterol. So that sounds like a pretty big deal, right? If every cell in our body is made up of cholesterol, that if we're going to manipulate the level of that, well, we have to, think about that. So, it's important also to know that not only is it the backbone of every cell in our body, but it's also the prime component of our steroid hormones. So our steroid hormones, such as estrogen, progesterone, testosterone, cortisol, these are big, big hormones, really important hormones. So changing the level of our cholesterol, we have to can't just off the cuff say we want to do that, take medication, lower it. So let's think about why the doctor in Angela's case wants to lower the cholesterol. And it's because cholesterol in the early 20th century was thought to be related to heart disease, because autopsies in humans and then rabbits on high cholesterol diets seemed to have a lot of cholesterol in their arteries. So it seemed like there was a correlation, and I'm going to talk a lot about this in my podcast going forward. There's a comment that I like, a phrase that I like: true, true, and unrelated. Okay, true, and unrelated means that true, let's say there's cholesterol in atherosclerotic arteries. Those are blocked arteries. True, there's cholesterol that's high, but are the two related? Okay, so or is there someone has a heart attack and there's cholesterol in their arteries? Are there true? Is it cause and effect? Well, it's really important to look at that question, because primary prevention from heart disease means giving medications to people like Angela, who never had a heart problem, and giving it because for primary prevention, for preventing the first episode of heart disease. So that's really important to understand, because the studies that are showing primary prevention are really not. Yeah, I'm going to go over that in a second. I just want to ask Angela if you're familiar with the term, because and this is maybe a trick question, because I wouldn't expect you to be familiar with it, but I'm going to ask you. There's a term called absolute risk and relative risk. Have you ever heard that
Yes.
those terms before? Maybe you've heard them. Do you know how that might influence how we look at cholesterol and how doctors look at the cholesterol? Now, I'm going to go into that in a second. I just want to ask you, Angela, how pushy was the doctor? Did the doctor say anything that was pushy, like, oh, well, don't blame me if you get a heart attack or something like that?
Right.
How was that
No,
handled?
I never really got the guilt trip of do
Good.
this or else. So I was happy about that. It was always seeming to be my choice. I don't think most people would say no once a doctor says do this, and that's kind of law. But they've always said, okay, they can't push a medication on you, because I don't have a heart issue. I have heart issues in my family history, but me, myself, I've never had any problems with that. So I don't think cholesterol medication is a prevention, because I'm not an absolute risk.
Right. Exactly.
So,
Okay.
and
So
that's where I thought, I needed to dig a little bit deeper about what else is happening besides just the higher levels. And also, is the pharmaceutical company changing what that level is that's considered high?
yeah. That's a
So
good point. Glad you brought that up.
so
Right.
it was, the pharmaceutical company 25 years ago said I needed to be on medication at a total cholesterol number of 192. So now they've raised it to 200, anything over 210. So it just seems to be fluctuating, which made me not really trust who I was getting the information from and why I needed to be on that medication.
Yeah. Because actually back in the day when I first started, the number was 240. Okay. And then they lowered it to 200. So right around the time when your 192 was told, you were told that it was high, was right around the time they decreased it to 200. Now, you're going to hear me a lot on these podcasts talk about the pharmaceutical companies. I don't want you to get me wrong. I'm not anti-pharmaceutical company but what I am is pro-truth. Okay. And so
Yes.
I mentioned the idea of primary prevention, and I'm going to kind of give you the scenario of how this works in medicine. And so when you're dealing with a doctor, you understand what a doctor, the pressures that the doctor is under to promote this stuff. So the top 5 studies uh, showing that primary prevention, that giving a statin medication is beneficial for primary prevention, meaning preventing someone who has high cholesterol from getting a first heart attack. The 5 largest studies, and I'm just going to refer to my notes. There's the Jupiter study, which studied Crestor, and that study was sponsored by AstraZeneca, the maker of Crestor, rosuvastatin. The 𝐆𝐔𝐘𝐒 study, which is the West Scotland Coronary Prevention Study, which studied pravastatin, Pravachol, which is a Bristol, and was sponsored by Bristol Myers Squibb, and that's a Bristol Myers Squibb. And that was the first medication that was talked about for primary prevention. I remember going on a trip, a dinner, and actually it was a luncheon and a baseball game back in the mid-90s, talking about Pravachol and primary prevention. ASCOT, the Anglo-Scandinavian Cardiac Outcomes trial, was sponsored by Pfizer, the maker of Lipitor, and that was a study showing that Lipitor helped with primary prevention. And the HOPE study, which was sponsored by AstraZeneca, looked at statins in general, lowering primary prevention. And then there was the MRC BHF heart protection study sponsored by Merck and Roche, regarding the statins lowering your risk of getting a heart attack, even if you don't have heart disease or never had heart disease. But when I say it showed that they help with primary prevention, how did it show it? And this is where we talk about absolute and relative risk. So for instance, let's say that 2 people in a town out of 100 would get a cold every year. But now a company makes a medication that cures the cold. And now only 1 person out of 100 gets a cold. Well, that's a risk reduction, a relative risk reduction of 50%. However, the absolute reduction is only 1% because it only went down by 1. Every one of these studies that I talked about that showed that cholesterol medication lowers your risk of getting a heart attack all looked at absolute risk. I'm sorry, relative risk. They looked at the percentage. So for instance, if in the HOPE trial, let's say, or in the Jupiter trial, if those people who didn't take Crestor, 2 out of 100 got a heart attack, and though they didn't have heart disease, people who didn't have a heart disease, 2 out of those 100 got a heart attack after 5 years, but only 1 on Crestor got a heart attack, they would report the results as that Crestor reduced the risk of a first heart attack by 50%. Meanwhile, it was only 1 person out of 100 difference of 1%. So that's really key. So when I was talking with Angela and she told me about this the high cholesterol, I said, well, let's look at something. In medicine, there's a term called phenotype, and the way that I remember that, in medicine, we've thrown around so many big terms. I always had to make it a mnemonic or make it something that I could remember. So phenotype, it sounds like an F, even though it's PH. It's the face of whatever your genetics are. So Angela was telling us that in her family runs high cholesterol, but what's the face of that cholesterol? Meaning, how does that show up in the body? Her genotype, her genes are high cholesterol, but how does that show up in the body? So if Angela, who we're similar ages, and if you need to go on cholesterol medication, well, you're high cholesterol, you've had high cholesterol all your life, you'd think that let's see how it affected you. So tell us a little. So I recommended that you get a test, and tell us a little bit about that.
Mhm. Yeah, so I had never heard of the calcium score test, and doctors that I've been to in the past have never suggested that. And in my conversation with Charlie, he said, to look at the levels of what the calcium is in my arteries is a simple test. And that's exactly what it was. It was about 5 minutes at the most, and my calcium score is zero, which I was happy. It put my mind at ease to say, well, that calcium is not settling in my arteries, and that is a, a peaceful thing to know,
Right.
so that I can make an educated decision for my body to say, no, I don't really need to go on cholesterol medication. So I've taken some other steps towards that now that I have that information. And I'm going to get another test that will tell me the size of the particles and if they're going to be adhering to the walls at all. And so I'm doing this 3 month, I'm doing a Prolon fast for January, a Prolon 5-day fast in February, and then doing blood work in March. And so it'll be interesting to see after all of this information compiles if there's any change.
Right. So the thing is, and we'll talk more about the particles because what's happened is we've tried to develop tests, what are called biomarkers, to see if we could
Mhm,
try to be a little bit more granular to try to sort out why
mhm,
some people with high cholesterol get heart disease, why some people don't. And the reason why I suggested a calcium score is that really, cholesterol doesn't cause heart disease, but if it
mhm,
accumulates in the blood vessels, it can start narrowing the artery. And how does it accumulate in blood vessels? Well, it's really an injury to the blood vessel. That's really an injury. Any type of injury will cause inflammation. And the first lecture I had in medical school, we talked about what's called the wheel reaction. The wheel reaction is if you slap your arm, it's going to start getting red, and that's inflammation. So that's the first sign of an injury. So if there's any injury to a blood vessel, then things in the blood that are going through it can kind of seep through. And, we've
mhm,
learned that inflammation is a marker of injury. And so that's a whole other conversation. And we'll definitely, in this podcast, talk about that. But what I want to kind of go into is really, um, again, not everybody needs cholesterol medication, but some people do.
mhm,
Now, I had a person walk into my office and they know that I was an open-minded doctor. I was open to conversations. I was open to listening to what people learn about on the internet. And many patients, many people are much more knowledgeable these days, even than their doctor, believe it or not. Because if they have a
mhm.
condition, they get very knowledgeable about that. And it's important for the doctor to listen to that. But I had a person walk into my office who was clearly probably 200 pounds overweight and said to me
Mm.
that, look, I don't like to take medications, Dr. Glassman. But I looked at her and I said, I'm sorry to say this, but until you get your lifestyle in order, you're going to have to be on medication. So there are times that you do need to be on medication. And if you are, if you have a very strong history of, if you've had a problem, you have heart disease, um, multiple risk factors, poor lifestyle, you may need to be on cholesterol. The calcium score is a great way to what we call stratify risk, determine your risk, because what Angela was talking about, her calcium score was zero, and what that means is that calcium adheres to inflammatory processes in the body. So if there's inflammation in the artery, inside the artery, then calcium is going to stick to that. And that's going to be a sign of it. It's not the only sign, and it's not but it's a good sign. It's a good way to know, to give a doctor some more information to know whether or not you need to go on cholesterol medication. And
Mm.
uh, even if Angela's particles are elevated, I don't even know that that's a reason with the phenotype showing up good, and the calcium score being so good, probably not necessary. But I'm going to I just want to, for those people who do have to go on medications, I do want to tell you a couple things which are musts if you have to go on cholesterol medication. One of them is to take coenzyme Q10, because statin medications will exhaust your
Mm.
coenzyme Q10 in the body, which is a major component of the energy cycle in your cells. So you need to be on CoQ10, usually 100 milligrams. Take the lowest dose possible. And what doctors won't tell you and the pharmaceutical companies won't tell you, you can usually get as much bang for the buck with a smaller dose than the larger dose. You don't even have to take it every day. So you can get, so I'll give you an example. My father, who's 92, not that I'm excited that he's on it, but he doesn't have a history of heart disease, but his doctor has him on it. I'm not going to get in the middle of that. But I saw his cholesterol levels. I said, Dad, just take it 3 days a week. So he goes back to the doctor every time, and the doctor says, okay, your cholesterol's great. Keep doing what you're doing. So, that's, yeah, I said to, my father, don't tell him that you're just taking it 3 days a week, because they'll have a problem with that. So, that's, that's one thing to do. And the other thing is you can have it compounded. There are many pharmacists who, just like the old pharmacists, the mortar and pestle, they'll grind it up and they'll put it in a capsule at a lower dose, and you can usually get it the bang for the buck if you want to take it every day. So that's something. And just before we go on to the happen segment, which I really I really want to talk about, especially with Angela. I'm sure she has something great to share with us. The Really important to understand that your doctor is under a lot of pressure, and what happens with doctors are very busy. It's hard to keep up with, and I'm talking from experience, many years of experience, hard to keep up with the latest and the greatest. Most of us look to our medical journals, New England Journal of Medicine, JAMA, Annals of Internal Medicine. We look at these and we go to the study, we go right to the conclusion and look at the conclusion. So you can put a lot in that conclusion, and most of what I was talking about, that relative risk, is in that conclusion. So doctors go away thinking without analyzing, because it's very hard. You have to be a statistical expert to really sort it all out. But we rely a lot on the pharmaceutical companies and their representatives, the pharmaceutical reps. They come into the office and they are experts, believe me, on the conditions that these medications treat. They are experts. So we learn a lot from them, okay, on that particular condition. They will tell us the pathophysiology, the biology, the physiology of how the condition works and how their medication helps it. So what happens, the pharmaceutical company indirectly can sponsor or directly sponsor a study. That study the doctors will read the conclusion. The pharmaceutical rep will come into the office and reinforce that conclusion. And then it becomes standard of care when most of the doctors in the community start doing that. So giving cholesterol medication for primary prevention, even if you'd never had a heart attack before, has become standard of care. So that's very hard to for a doctor to go against, because the first thing in a malpractice case, they'll ask if the doctor deviated from the standard of care. So it's important to understand that and to have a dialogue and to help the doctor understand that you understand the doctor as well. So I think this was great. Angela, is there anything else you want to
Yeah.
share about this experience you had with cholesterol and making your decision making? We're going to be on again to talk about the Prolon and the fasting and some of the other stuff you've been doing. But as far as the cholesterol and how you've decided to move on or to deal with that, any thing you want to tell anybody?
Well, the ownership of my health is more of a mind, body, spirit thing. So I don't usually take one person to tell me what to do. So I'm going to inquire, and I'm so happy that Charlie was able to kind of give me some insight, and I got some conclusions from that. So I think just having an open mind and asking questions and just not taking it for, hearsay of what one doctor says. I'm a great believer of the whole body. So I appreciate the fact that I've said no all these years because
Mhm.
I don't have any side effects from the medication. And I'll just keep fighting it and saying no until something really shows itself that it's necessary. Because I'm not against it,
Mhm.
but it has to be absolutely necessary.
Yeah.
So, but I appreciate the way that you practice because you are taking in the whole body, and it's the whole mind, body, spirit. And I really think that has a lot to do with it.
Yeah. Yeah. Thanks for sharing that. And just one thing that brought up when you talked about the side effects, a lot of doctors will tell you that, oh, they're safe, there's no side effects. And for most people, there aren't. Some people may not know that, but what are the long-term side effects? And so just looking at some of my notes that I have here,
Mm.
um, there's been several studies that look at the dangers of too low cholesterol. Now, cardiologists have a very myopic view of lowering cholesterol. How low can you go? They feel like you have to lower your LDL cholesterol as low as possible. LDL, by the way, is a carrier of cholesterol. It's something that helps the cholesterol go travel in the blood. It's like a bus, and the cholesterol, it's its passenger, and the or a submarine really, because it's going through water, which is the blood, and cholesterol can't go through the water on its own. It's a fat, so it's like a globule. So it's like a submarine transporting the cholesterol. That's what LDL is. And there's been studies showing that too low cholesterol can increase the risk of, in fact, the National Health and Nutrition Examination Study, 1999 to 2014, showed that very low cholesterol levels of cholesterol, LDL cholesterol less than 70, had a higher risk of all cause mortality, meaning death of different causes, whereas a very high also. So a U shape means it goes up here, very high risk when it's very low. When it's normal, risk goes down. But when it goes high, risk goes up again. And there are several studies, another large study of 12.8 million and another large study, similar numbers showing that there is kind of a U-shaped curve. So it's not without potential risk trying to lower your cholesterol as low as it can go. For most people, for some people, it might be important. So, but I want to shift gears, and again, uh, dealing with people. I always looked at my patients as people, right? As human beings,
Mm.
and not just patients that we instruct or we take care of. It's always been my goal to give people the tools to help them take care of themselves. And as Angela was saying, that's what she likes to do is take ownership of her body and take ownership of her health care and her wellness. And a doctor's position is really, except if you're a surgeon and need to cut something out, okay, sometimes you need that. But if you're a general doctor and giving advice to patients, guiding them, it's important to give them the tools, not just say you need to take care of them. So part of that giving
Mm.
them the tools is helping people understand that we're not just a body. We have a mind, we have a spirit, and it's very important to take that all into consideration. In fact, most of the writing I've done has been on the mind and spirit. And with my book, Brain Drain, Fake News Stories by Your Brain, um, these are things that dealt a lot with the mind. But one thing to help us tap into that in our life, and most people, they think it may be a little woo-woo or whatever, but no matter what your feeling about it is, we've all had situations in our life where we take a step back and say, that happened. And when we start understanding those things and internalizing them, it gives us more hope and faith that there's something larger than ourselves. And I have many to share, but I'm going to give Angela the opportunity to give something that happened to her where she could take a step back and say, wow, that really happened. So,
Yeah. Thanks, Charlie.
yeah.
The one experience, and like you said, there are so many that I could glean from, but I think this one is the last 2.5 years. Most of us know if you're pre-retired or downsizing or whatever that is, selling your house, the kids are all grown. 2.5 years, we were called to move out of location in New York, New Jersey after 35 years. And all of our raising of our children, all of our friends, everything that we had established was there. And through that process, 2.5 years ago, of shedding and letting go of layers and layers of things, and not really knowing exactly where we were going to land in Florida. We knew the area because our son is here and our daughter-in-law, and that was a gift to be able to reconnect with them and live close by them. But we really didn't exactly know where we were going to land. And it was basically, we needed to trust that this process was going to be just as it's going to happen. It's just going to happen. And so I think as we traveled that first year and a half, and we were kind of dislocated and living in a condo on the beach, not that it was bad. It was certainly a lovely situation, but it was disruptive to everything that we knew, which causes stressors, which causes disruptions, but it also calls us to understand that in past situations, we have been called to certain things and we have been kept in a way by our higher being, whoever you want to call it, in a way that is going to bring you through to another situation.
But I know
And
you call
so
it God, and so
trusting,
do I. I just want to interrupt that. But
I
that's
I
a
call it I call it God.
yeah,
And
as do
and
I, but
I'm a
that's
woman
okay
of
because
faith.
yeah, as you say, other people
Yeah.
look at it differently. But go ahead.
Yeah, and I'm sensitive to that, and so I'm a woman of faith, and I trust that God calls us to a certain place, and He will keep you through that place, and there will be a blessing, one way or another. So through the process, within the last 2.5 years, we have lost offers on houses. We have gone through various situations. And you attach to a place and you think, this is it. I know that this has been brought to me. And then the door closes and you realize, okay, you've got to be okay with that door closing because you know that there's going to be another door that opens. There always has been in the past. And at this age, you sort of look back in retrospect how you've been taken through certain situations. And we landed on this house about 18 months ago, and I'm a gardener, and I walked into this house and there was more than enough containers and planters and plants, and it was an abundance of more that I could even ask for. And it basically just happened. I mean, there was a lot of competition in the market. There was a lot of people offering on this house, but there was a connection with the owners that connected with our spirits and our hearts, and they embraced us and they wanted to know that this was going to be our new home. And I had to look back and just say that just happened because there was nothing. Sure, we did our due diligence and we did our you're searching every weekend, going to open houses. It was like a job that we needed to do. But God just opened up that avenue for us. And I could speak on so many other situations that, I could have never created that to happen,
Mm.
but it was created. And I was mindful enough to enter in to that specific moment and say, wow,
Mm.
that just happened. I I did my little bit, but it was way beyond my control. And
Yeah.
and I always say, when the wave comes, it just kind of takes you
Mm.
and you move with it and you trust that moment. And then we are at this place of blessing. We are at this place where we're close to my son. We're close to where he lives, and that's an easy thing if we need to get together with
Mm.
them. Um,
Yeah.
so it all really was a blessing. I mean, so many other things that I could say. My other son that is in New York, and our local church has embraced him, and he's got a great kitchen that he works out of. That just happened, and he
Hmm.
works down the street from his workspace. That just happened, and
Right.
so I just think you just keep looking at those, and you are thankful
Hmm.
and grateful for how you've been called and you've been kept through those situations, and how you could then turn around and say, thank you for the blessing,
Yeah.
and have a grateful heart.
And you're sitting at your table now with your
Yeah,
backyard in the,
with my greens
yes, I
and
love
my
it. I
plants.
love it.
So
Yeah.
it's been just it's surely, it's no easy task to move.
Yeah.
Um,
Not
and
at
I'm
all. Wow.
talking to all of my, friends who are in the process of letting go of everything that they knew. And it's not a bad thing to stay where you are and stay, put
Hmm.
until your dying day. But in your mid 60s, you start to consider this other possible life,
Hmm.
that you're not raising children, and you don't have those same kind of pressures. And you say, okay, God, where do you want me?
Yeah.
Where can I serve, and where do you want to plant me? So
Yeah.
I'm grateful that I get a lot of visitors here,
Mm.
which
Yeah.
is which is
Us
awesome.
included.
Yeah, and
Yeah.
and that's an awesome thing. And I
Yeah.
I love being hospitable and having people from cold countries come and thaw out a little bit.
Hmm.
But
Yeah. Who
I
doesn't like to go to the
think,
Sunshine State?
yeah, exactly,
Yeah.
exactly. So,
Yeah.
and all of it, and I think it's had a big impact on my health,
Mm.
because it's kind of funny. People say, oh, all those people that go to Florida are just going there to retire and grow old and die.
Mm.
Well, I guess we're all going to die at some point
Right.
anyway. Yet, um, people here are more active because you can be. And
Hmm.
so we can walk 12 months of the year and not have it be a problem. But
Yeah.
I'm looking at it now more as a blessing than it was a great disruption about
Mm.
2.5 years ago.
Yeah. I can
So
understand that.
it's totally different. As much as I miss everyone in the north, I don't miss shoveling, and I don't miss
Right.
a whole lot of that frigid cold weather.
Yeah.
But
Well, yeah. Well, moving is
uh,
is one of those highest stress on the stress. I think it's number one on the scale of
yeah,
only above
yeah,
public speaking or something. So
exactly, exactly. So we got through it, and if I could be used to encourage any of my other friends wherever they're called to go, as they downsize or just start shedding some of the past,
hmm.
it's a challenging thing, because
Yeah.
most of us have our parents' things that we've
Mm.
inherited, and layers of those things that we need to take with us. But somehow there's a lesson in all that letting go, right?
Yeah, yeah,
So,
yeah. Well, I think you said the key word is trust, and trusting when something happens that just that falls into your lap in a sense. Sometimes you just have to trust that. And I think
mhm,
back at an experience with me when I was in my last year of residency. I didn't know what I wanted to do. Um, so I signed up for a pulmonary fellowship. Okay, that's a lung specialist, right? Not that I was particularly interested in the lungs, but everybody was doing a specialty. And I thought, okay, that's pretty interesting. Let me do that. And this was January, many, many years ago. Okay. Well, a
mm,
day later, the chief resident of the program came to me and I guess he respected me. He asked me if I wanted to do it. He said there was a doctor in the county who's across the Hudson River, who needed somebody to moonlight in their practice because they were going on vacation. And asked me if I wanted to do it. And I said, sure, I could use an extra couple bucks. I'm in my 20s, whatever. It sounded good. So I went there and I was moonlighting and I did it for 2 weeks. I got along very well with the staff and the patients, and he offered me a job. And I started there and never left. And that's where I raised my family. And we, have had a wonderful life. But this is where you have to trust. And I say that really happened. It was almost like the hand of God had come down and said, no,
mm,
you're not doing this. This is what you're supposed to be doing. And I've had, many of those in my life. That's just one I'll share. And as Angela said, sometimes you just have to trust in that. And that trusting, that's what really incorporates an inner strength and a vitality and a
mhm,
confidence to be able to go to your doctor, knowing that the doctor's not, your God or the universe or whatever, and you kind of have tapped into something a little stronger. It gives you the confidence to question and to say, well, what do you have to say about this? And
mm,
so I think that it's important to consider these events that happen in our life because they round everything out and they make us truly human and elevate us with a
mm,
confidence that can't be taken away. So, um,
mm, mm,
yeah, thanks for sharing that story, Angela, because that kind of sparked my memory of my story and the idea of trusting,
mm.
when something
Yeah,
happens.
yeah, yeah. It is basically all about that trust because we're given so many different directions and decisions to make, even in a day.
Yeah. Yeah. It's
And,
yeah.
we know we don't have control over a whole lot, but we do have some control of how we respond to it, not react to it. So I
Yeah.
think that's the key to, okay, how am I going to enter into this mindfully to move from A to B
Hmm.
and know that God is keeping me and holding me through that situation. So um, trusting is
Yeah.
major. And
Yeah.
and that and like you said, I tie it into my health. It does give me the confidence to say, okay, you know, is this what you'd want from me? You calling me into taking a medication, or are you
Hmm.
calling me to say no? And
Yeah.
then I can say no. I
Yeah.
I have I have the option to say no, and that's
Absolutely.
okay.
Yeah. And getting back
So,
to that, just for the viewers and listeners, when you do say no, if a doctor starts giving you a guilt trip, Angela was lucky she didn't get that, but many doctors will give
mhm,
you a guilt trip. Um,
right.
And in fact, I had patients come to me as they're to be the doctor because they left their doctor because of the giving guilt trip. But there's also another hint that I'll give you, kind of an inside. When a doctor says, well, studies show, or that doesn't
Mm,
work, or studies show that that doesn't work, or studies show this, um, I could promise you 9 times out of 10, they're shooting from the hip. they're not really referring to a specific study, or they heard about a study, or they read the conclusion of the journal article that was sponsored by the pharmaceutical company, or the pharmaceutical rep told them that there was a study. So you really have to look at the whole picture. And not only looking at the whole picture of medicine, but looking at the whole picture of who you are as a person, mind, body, and spirit. And I think that that's, the message that I'll leave for the listeners and viewers. I'll leave you with that today to think about. And certainly, I'd love to hear from you if you have any questions. Angela, thank you so much for being my guest. And this is my first podcast.
Absolutely.
Angela has agreed to be the first, and I really appreciate that. I thought it was an important topic and to delve into, because so many people have these questions. And if you have any more questions, please feel free to leave them wherever you hear this podcast or listen or see it on YouTube. And until next time, Dr. Charles, aka Coach MD, urging you to stay strong in mind, in body, and especially in soul. So until next time, bye for now.